So, uterine fibroids. It's a term you've probably heard thrown around, and maybe you even know someone who has them. Well, today, we're going to pull back the curtain on this incredibly common condition and give you the clear, straightforward info you've been looking for.
Hey, welcome to MediByte. Our whole goal here is to take tricky health topics and just make them simple. So, let's jump right in.
All right, let's kick things off with a number that, well, it might just surprise you. By the time they hit age 50, a staggering 80% of Black women in the United States will have had uterine fibroids.
And look, this isn't limited to just one group. Around 70% of white women will also have had them by that same age. The big takeaway here, this is just incredibly common.
Okay, so we've established they affect a huge number of people. But what in the world are they, really? Well, that's exactly what we're here to figure out. So here's our game plan for today. We'll start with the basics of what fibroids are, then we'll get into signs and how they're diagnosed. After that, we'll walk through your treatment options, talk about fertility, and finally, wrap it all up with the key things you need to remember. All right, let's dive right in. First up, what even are uterine fibroids? Let's get down to the basic definition.
In the simplest terms, a uterine fibroid, and you might hear a doctor call it a myomectomy, is just a growth in the uterus. And please hear this next part loud and clear. It's the most important thing on this slide. It is a non-cancerous tumor. It's just made of muscle and fibrous tissue, and it is not linked to a higher risk of uterine cancer.
So what makes them show up? The honest answer is the exact cause is still a bit of a mystery. But what we do know is that there's a really strong hormonal connection. You can kind of think of the hormones estrogen and progesterone as fuel for fibroids. That's why they can really grow during pregnancy when your hormones are surging, and then they often shrink back down after menopause when those hormone levels drop off.
Now, fibroids don't all pop up in the same spot. And their location, it's actually a huge piece of the puzzle for understanding what kind of symptoms they might cause. So let's look at the three main types.
First up, you've got subserosal fibroids, which hang out on the outside of the uterus. Then there are intramural fibroids. These are actually the most common kind, and they grow right inside the muscular wall. And finally, you have submucosal fibroids, which are right under the uterine lining and can even bulge into the uterine cavity. Yeah, where they are makes all the difference.
Okay, let's move on to our next section. See, knowing what they are and where they are helps us make sense of the signs and symptoms they can cause and how a doctor confirms it's really a fibroid.
Now, this is really important. Many women have fibroids and have zero symptoms. None at all. But when symptoms do show up, they often depend on the fibroid size and location. The number one most common sign is really heavy or long periods. You might also feel a sense of pressure in your pelvis, or, if a fibroid is pushing on your bladder, you might find yourself running to the bathroom all the time.
So how do you get a diagnosis? Well, the path is usually pretty straightforward. It often just starts with a regular pelvic exam. If your doctor feels something, they'll probably suggest a transvaginal ultrasound to get a really clear picture of what's going on. And sometimes, if they need even more detail, they might order an MRI.
All right, now for a super important topic, treatment. If you have fibroids, what can you actually do about them? The really good news is there are a lot of different options. See, treatment isn't a one-size-fits-all thing. It really comes down to your goals. On one hand, you have options that are all about managing your symptoms. Things like medications can help with heavy bleeding and pain, but they don't actually get rid of the fibroids. On the other hand, there are procedures like uterine artery embolization. This one directly targets the fibroids by blocking the little blood vessels that feed them, which basically starves them and causes them to shrink away. And then you have the two main surgical routes, which are very different. A myomectomy is where a surgeon goes in and removes just the fibroids, leaving the uterus intact. This is a really important option for women who want to have children later on. The only catch is, new fibroids can grow back. Then there's a hysterectomy, which removes the entire uterus. It's a permanent fix for fibroids, but it also means pregnancy is no longer possible. As you can see, it's a huge decision and one you make as a team with your doctor. Which, of course, is the perfect lead-in to our fourth section. How do fibroids impact fertility and pregnancy? This is, understandably, a major concern for so many people. So first off, let's be super clear. Tons of women with fibroids go on to have totally healthy, normal pregnancies. But it's true they can sometimes cause issues. Depending on their size and especially their location, they can sometimes make it harder for an embryo to implant. They can also, in some cases, raise the risk of things like miscarriage or preterm labor.
Okay, that was a lot of information I know. So let's bring it all home in our final section. What are the absolute most important things for you to remember from all of this?
And this, right here, is probably the most important takeaway of all. If you have fibroids, but they aren't causing you any problems, you might not need any treatment whatsoever. A lot of the time, just watchful waiting is the best approach.
So let's do a quick recap. Remember, fibroids are super common and they are not cancer. Your experience with them might be totally different from someone else's. There are so many treatment options out there, from doing nothing at all to surgery, and most importantly, this is your health journey, and you can partner with your doctor to figure out the absolute best path for you.
And that really just leaves us with this final thought. Now that you have this knowledge, what's the right next step on your health journey? Maybe it's starting a conversation with your doctor. Maybe it's just paying closer attention to your body. Whatever it is, you're now more empowered to take that step.
Thank you so much for hanging out with us here at MediByte. If you found this explainer helpful, please give it a like, share it with someone who could use it, and definitely subscribe for more simple guides to complex health topics. We'll see you in the next one.